Hello, this is Brenda Weber, and this is the Week 6 assignment, Endoscopic Procedures, and the procedure that I've chosen is a colonoscopy. You'll need to follow my prompts to go to the next slide. So let's get started. What is a colonoscopy? A colonoscopy is a common diagnostic procedure that allows a provider to visually inspect the interior lining of the colon. If you look at the image, on the screen, this is what your provider will see. It'll be illuminated by the light at the end of the scope, and it's going to go through the rectum all the way through the colon. I'll talk a little bit about that more later. So the procedure usually takes 30 to 60 minutes, but the total time you could be in the office is up to 3 hours, and you will not be able to drive home after the procedure, so you'll have to have someone pick you up. Almost all colonoscopies in the United States are performed under a level of sedation, deep sedation. This prevents the patient from feeling anything, and this is not something you want to really be aware, but it's your choice. The day before the procedure, the patient is instructed to fast 12 hours before, and you'll be taking a solution called Go Lightly. This is going to cause osmotic diarrhea. You'll take that last slow dose, drink the last bit of it, about 2 to 3 hours before the procedure to make sure the colon is completely cleaned. It is recommended that all adults 50 to 75 undergo colorectal screening. If they find something, it could be as often as every 3 years. If nothing's found, it could be 10 years. But regardless, every individual 50 and over should have a colonoscopy done. Right. Next slide. Sorry about that, I had to start again. So we're on viewing inside the colon. So if the provider finds something abnormal, tissues or a condition, they'll take a sample and send it to the lab so it can be diagnosed and see if it's cancer, or if it's cancer, is it benign? Most often it's benign. There are several medical conditions that explain a patient's symptoms. Some that the doctor will be able to see is ulcerative colitis, Crohn's disease, diverticulitis, which is very painful. We talked about cancer, usually benign, and most often there are growths on the wall, and those are polyps. Those polyps are removed immediately during the procedure. There's something called a virtual colonoscopy, and this is another screening technique that I just found out about. It's non-invasive. So you take an oral contrast so it can illuminate the colon, and this is done by a radiologist in a CT scan, and you get a 3D image, which is less traumatic, but I don't know how much more effective it is. You do have the capability to remove polyps during that procedure too. Right? Let's go on to the next slide. Anatomy and positioning. So for colonoscopy, before starting the procedure, the patient is going to be placed on their side in a position called lateral recumbent. That means you're on your side, your head is slightly down. For a flexible scope, which is what I'm familiar with, the patient's on their right side, head is slightly low, and if it's a rigid scope, it says they're placed on their left lateral or sternal recumbent side. So I don't know too many providers that use rigid anymore. So the table is slightly tilted, and this is toward the patient's head, and this is to prevent any material leaking, because this is not a sterile procedure. It's clean as that part of your body can be. So you want to prevent leaking and control, be able to suction whatever materials out to make sure the provider has a clear view. All right. Next slide. Equipment, instruments, and supplies. So before you begin the procedure, you'll go to a prep area where a RN will insert an intravenous line, IV, and that's so you can receive the medication for sedation or any other medication they may need to give to you while you're in the procedure. because you're in deep sedation, they're going to monitor your heart rate, blood pressure, oxygen levels. And in my case, I received some oxygen through a nasal cannula. The medication that I was given, I'm sure most people are familiar with, is called propofol. This causes you to be deeply unconscious. You don't remember anything. You remember going into the room, and the next thing you know, you're waking up in recovery. So the level of sedation is to be discussed with the provider. Some people don't prefer to be under deep sedation, and they can go lighter and be aware of what's going on in the procedure. So in the image, you see the monitor. You also have a good view of the handheld scope that the provider will look through, and the flexible tip that will be inserted through the rectum. Okay. So how all this works. After the patient is prepped and the doctor applies some lubrication, the scope is guided through to the length of the colon. So the doctor is going to be looking closely at the walls, searching for any of those conditions we talked about before, polyps and such. But the walls have to be inflated. So they're going to use carbon dioxide gas, which is pumped through the colonoscope in the instrument port. There's also an irrigation port if fluids need to be given. Where the light source is, it can move in up to 4 different directions, so the provider has a better view of everything in the colon. And we talked about the virtual colonoscopy that's done by x-ray. Next slide. Hit the button. Gases or fluids is necessary to distend the colon, as we talked about, so the provider can see and safely navigate through the mucosal lining of the colon. So you want it to be as wide as possible, so you're not pushing or tearing, which will be one of the risk and complications I'll talk about last. Carbon dioxide or carbon dioxide insufflation is designed to distend the walls of the colon. And carbon dioxide is used because it is 13 times faster being absorbed than oxygen, and 160 times faster than nitrogen. So the study I read said that CO2 greatly reduces abdominal discomfort and bloating, and I can't imagine that anybody would want to be bloated or in discomfort after this procedure. Next slide. So risk or complications. This is the last slide. So as with any procedure, risk and complications can occur, but they are rare in a colonoscopy. A study showed that 4 to 8 serious complications occurred out of every 10,000. So with the experience of the provider and the equipment, it's relatively safe. But if there are complications, the most common is going to be a perforation of the colon. That's why I put that image in there. So the instrument goes through a weak wall or something like that, and there could be bleeding. It might require antibiotics, because like I said, this is not a sterile procedure, and so the provider will have to stitch that site up. There may be some uncontrolled bleeding from a polyp that's removed, especially if there are several polyps, and the provider will have to stop the bleeding on those. And as always, abnormal reactions to anesthesia could occur. So the latter is less common, but it could happen. Some people may not know they have a reaction to a sedative. And underlying heart problems or breathing problems could interfere. I'd like to note that deaths from colonoscopies are very rare. So as unpleasant as this procedure is, it is necessary. Everybody over the age of 50 should have a colonoscopy, whether you have a family history of it or not. So I thank you for your time, and that's it.